Hi, thank you for attending our webinar today. We will be addressing the health disparities faced by minority populations living in rural areas, specifically in Meriwether County, Georgia. Overall, rural communities face an unshared burden of health disparities when compared to urban communities. In Georgia, at the 2010 census count, the population was about 10 million, and about 1.7 million resided in the rural area. Meriwether County is a rural community located in west central Georgia. It has almost 22,000 residents at the 2010 census count, with whites being the majority at 58%, followed by blacks at 39%, and 3% comprising of other minority groups. The National Prevention Council in 2011 reported that those living in rural areas are more likely to have chronic conditions and are less likely to receive preventive care due to lack of access. Unfortunately, it is the minority populations in those rural communities experiencing the brunt of those health disparities. To highlight that point, in 2012, the Georgia Department of Public Health reported cardiovascular disease as the leading cause of death in Georgia. Cardiovascular disease includes diseases of the heart and vessels such as stroke, hypertension, and congestive heart failure. In 2008, the Georgia Department of Public Health reported that cardiovascular disease disproportionately killed men at a rate 4.1 times higher than women, and it also killed blacks at a rate 1.3 times higher than whites. In Meriwether County, blacks had a significantly higher death rate by CVD of 207.2 per 100,000 persons compared to whites at 177.8 per 100,000 persons, as reported by CHSI in 2015. Contributing to the health disparity is Georgia's location in the stroke belt, as defined by the National Heart, Lung, and Blood Institute in 1996 as 11 mostly southern states experiencing higher incidences of stroke rates than the national average. Also worsening the situation for specifically black minorities is southern states tend to have higher rates of uninsured persons, as reported by the Kaiser Family Foundation in 2013, which also reported that blacks tend to mostly reside in southern states. In Meriwether County, 21.5% of the population under the age of 65 did not have insurance, as reported by the CDC in 2012. Though data is not available on insurance rates by race or ethnicity at the county level, it does exist at the state level, with 14% of whites in Georgia being uninsured compared to 17% of blacks, 44% of Hispanics, and 26% of those identifying as others, as reported by the Kaiser Family Foundation in 2013. Historically, persons other than non-Hispanic white have been experiencing high uninsured persons rates in the U.S., as cited by the Kaiser Family Foundation in 2013. Now, with the Affordable Care Act, in 2012, the U.S. Supreme Court's decision in National Federation of Independent Business versus Sebelius made it the state's decision on whether to expand Medicaid coverage. As a result, Georgia's legislature decided not to expand. However, simply providing access to care and coverage will not eliminate the disparity because many will not seek medical attention due to cost. The Kaiser Family Foundation in 2013 reported that African Americans were 2.5 times more likely than whites to have a family income below the federal poverty level, and that the majority of employed non-elderly blacks were more likely than whites to be poor. Also, 70% of blacks were blue-collar workers, which means most of them do not receive health care coverage from their employer. In Meriwether County, residents had an unemployment rate of 11%, while the state was 6.3%, according to the Georgia Department of Labor. Unemployment data by race or ethnicity exists at the national level, with the U.S. Bureau of Labor Statistics in 2015 reporting a seasonally adjusted rate of unemployment for blacks at 10.1%, for whites at 4.7%, and for Asians at 3.2%. Employment is important because it impacts a person's access to health care, health insurance coverage, and overall health, as reported by the CDC in 2013. Key to obtaining a good job is receiving quality education. In Meriwether County, 28.3% of adults did not have a high school diploma, according to CHSI in 2013. In 2012, the National Center for Education Statistics reported the percentage of persons aged 25 and older completing high school or higher in Georgia as 87.9% white, 82.3% black, and 56.5% Hispanic. In 2013, the CDC reported for 2006 and 2010 years, the unemployment prevalence among the uninsured as 4 times higher than those insured, and when you factor in level of education attained and income, the prevalence rates for those years decreased. That data highlights the impact social determinants have on health outcomes. To summarize, for minorities residing in Meriwether County, they face a negative health outcome, including lack of access to health care and preventive services and health insurance, being more likely to have chronic conditions, being unemployed, and being physically inactive. And for some instances, depending on your gender, living in Meriwether County, the situation can be worse for you. So what can be done about this? Using the socio-ecological model, we can create solutions to eliminate the health disparities. On the political level, a permanent solution can be sought to ensure Medicaid payment parity for all providers accepting Medicaid patients. In 2012, the Medicaid program implemented legislation that would increase Medicaid payment for key healthcare providers to rates comparable to Medicare. The benefit to making such legislation permanent is it would change the current perspective healthcare providers have about accepting Medicaid patients. This would also increase access to care for Medicaid patients, especially in rural communities where a physician shortage already exists, but the physicians practicing in the area do not accept Medicaid patients. On the organizational and community level, another solution is to involve the residents and others in community-based participatory research and use the Rural Healthy People 2020 as a guide. Also, businesses, especially those that do not offer insurance coverage for employees, could offer an on-site gym and health education classes in an effort to raise awareness and create empowerment. Doing so is cost-effective for businesses because it helps to create a healthy workforce and eliminate costs from sick leave, rehiring, and unproductivity. Thank you for attending our webinar, and suggestions are welcome below.